with Plan4Health is a program coordinator. So basically I'm working on what's called an Active Living Places initiative, in which we are working to engage 3 communities, 1 rural, 1 suburban, and 1 urban, to help them engage in the planning process that takes into account their built environment and how it affects health. So for example, complete street policies, walking school buses, community liaisons who help to put together a community school program that would serve as a rec center, as well as education and food destination center, as well as working with local farmers markets and food cooperatives to kind of help with access to food within neighborhoods that are accessed easily through various transportation such as transit, biking, walking. These areas are generally considered food deserts or areas that have high poverty or high concentration of minority families or high concentration of children who are overweight or type 2 diabetes in adults. So we target a lot of communities based on health and then as well as the built environment and access. With our urban community, which is City of Madison, we were able to basically connect our various agencies that deal with, transportation or are dealing with community development, and have them come together to create a cohesive project within our target neighborhood, connecting some projects that are ongoing, like a street reconstruction and putting in walkways where, previously people had to walk out of their way to access any main streets. So different things like actual, physical changes. And then on the other side, with some of our rural communities, you have kids who are taking a 30-minute bus ride for what would be less than a 10-minute walk to school. So what we, put together walking school buses so that the kids could actually walk with their friends and have a safe way to school and different things like that. So I think people are more connected with their planning process. They're people who are making decisions in terms of the built environment. People are understanding more of what the process is for making change. In particular, some of the organizations that partnered with us are able to advocate change based on their better knowledge of planning and the processes and how to interact, and also have programs that align to help promote it in the community in a way that people can understand. So it's a lot of bridge building and collaboration that came from this. I studied transportation planning primarily, as well as community economic development. So I had never really studied, public health relationships with a lot of, economics or I guess transportation. So it was kind of something I knew about in terms of, some coursework, but I had never actually understood how they work together until I joined a coalition in which, we had this conversation where you had multiple people present and we were looking at that as a targeted issue. And it helped me kind of put together a framework for how I could sell, transportation initiatives based on health, or how you can, sell health based on economics. So it helped me myself and, with the education I had and some of the knowledge I had, to kind of figure out different strategies to, sell planning as a whole, or health as a whole, or economics as a whole. So it's been pretty informative. It's been a growing experience this year.